name is Dr. Bruce Gray. I'm the Director of Endovascular Services at Greenville Memorial Hospital. An aneurysm is a unique problem with an artery. When an artery enlarges to twice its normal size, that's when we give it the name of an aneurysm. So it's actually a widening of the artery. The most common place you may find one is in the abdominal aorta, which lies deep to the belly button. Most patients that have an aneurysm are older. They've usually been smoking in the past, and the average age is about 69 years of age. We usually detect aneurysms with an ultrasound or a CT scan. Once it's kind of enlarged to the point of, say, 5 centimeters, then we may choose one of two treatment options for that patient. Let me try to outline either of those two options. The first option, which has been around for decades, is that of open surgery. You make an incision in the abdomen under general anesthetic. You go down and actually replace the aneurysm with a new plastic tube. You actually sew it into place. It's a big operation, but it works great because it totally removes the aneurysm. And once it's done, it's pretty much done. The second alternative, which has been around since 1996, is the placement of the same type of plastic tube, but it's put up from the groin into the inside part of the aorta and relines the aorta. It doesn't remove the aneurysm, it merely excludes it and keeps it from rupturing. It works great too. And so we use both of those at Memorial. However, we prefer to use the stent graft if we can, because it carries a lower risk. It can be done in about an hour's time and usually go home the next day. So it's really a markedly different procedure. But both of them are very effective at preventing rupture of the aorta. With the convalescence or the recovery of the patient is a lot different with open surgery than it is with the stent graft procedure, because the recovery from the big incision versus two small groin incisions are dramatically different. So you might ask, well, why would my doctor have to offer me a bigger procedure than the smaller one? Well, indeed, we look at it that way too. We'd like to offer anybody the smaller procedure if possible. However, sometimes because of angles, diameters, distances, or just the anatomy of the aorta, it's not feasible to get a good repair with a stent graft, so we have to offer the open procedure, and that's where the vascular surgeons work hand in hand with us, catheter interventionalists, that we can offer the right treatment for the right patient at the right time. I think whenever you're faced with a complex medical problem such as an aneurysm, you want to know what your treatment options are, and you want all those treatment options available and to be performed by people that do a lot of them, so that they're very experienced at handling not only the straightforward ones, but also perhaps the more complicated ones, so that if an issue would come up, they know how to deal with it and they can take care of it. And I think that's exactly the kind of care you can get at Memorial.